Welcome to the Wellness Law Podcast, where wellness and the law meet for contemplation and collaboration. This podcast is brought to you by the Center for Health and Wellness Law. I am your host, Barbara Zabawa. Welcome, Dr. Amy Bantham, to the Wellness Law Podcast. Thank you so much for joining me, everyone. I want to introduce you to Dr. Amy Bantham. She has a Doctor of Public Health from the Harvard T. Chan School of Public Health. She also is the CEO and founder of Move to Live More, which is a research and consulting firm that helps clients combine evidence-based research with practice for improved communications policy and strategy to get people moving. And what's really exciting is I learned that over the last couple of days, Amy was in Washington, D.C. to talk about the PHIT Act. And so that's going to be our focus today. But before we jump into that, Amy, welcome. And please share any more about your background that you think the audience would like to hear.
Oh, thank you so much for having me on the show. I appreciate it. I have my own podcast, and it's such a delight to be a guest on a podcast instead of hosting. So happy to be here. Yeah, well, thank you for the introduction. I am a longtime fitness professional. That was my entry into the industry. I've taught group fitness, and I've been a certified health and wellness coach and personal trainer for almost 3 decades, and I still teach group fitness today. I worked for over 11 years on policy and advocacy for the Health and Fitness Association, the association representing the health and fitness industry. And that's actually who I was in Washington, D.C. with, advocating for FIT. And so excited to talk about that. But so that's a little bit about my background. In 2017, I went back to school to get my doctorate. And I was really seeing that I wanted to be able to connect the medical and public health communities with the fitness community. And so in order to do that, I wanted to get my doctorate, which focused on a grounding in public health skills, but also leadership and communication skills. And as part of my doctoral work, I founded Move to Live More as a research and consulting firm because I didn't really see that anyone was doing what I wanted to do, which was to build bridges between and among the healthcare sector, the health and fitness sector, and the community sector to address physical inactivity and chronic disease. And so that was about 5.5 years ago. And I work with clients who are foundations, who are for-profit, health and fitness centers, who are not-for-profit organizations, and they are all aligned with my mission and my company's mission, which is to help people live healthier, longer, more active lives.
And you focus mostly on fitness. You don't do much with nutrition.
I do have a Master of Science in Applied Nutrition and my Doctor of Public Health, although I did focus on physical activity referrals. I try to really see it as a whole person health and holistic health focus. And so I do work which does focus on all of those pillars of whole person health, of lifestyle medicine, which includes not only physical activity, but nutrition, sleep, recovery, stress management. So really that holistic approach.
I love it. And I'm just curious. I know we're going to want to talk about the PHIT Act and your work with that, but I'm curious.
We'll get there.
Given your doctoral work and trying to bridge between the fitness and the healthcare medicine side of things, how challenging has that been? Or would you say the medical community, conventional medical community, has been very receptive to your efforts to bridge these two worlds?
It hasn't been without challenges. And interestingly, and I joke about this, when I sit on panels, I am often the person talking about barriers. And so they put me in the beginning because who wants to end with barriers? And so although I do focus on identifying those barriers, I also work with clients to try to overcome those barriers. So my doctoral work did survey and interview healthcare providers about their referral practices.
Mhm.
And it did survey and interview allied health professionals who receive patients from those healthcare provider referrals to talk with them about how they could better support patients in following through on their physical activity behavior change. And then when I work with clients, I work on implementing a roadmap that will help them become trusted community resources for healthcare providers. So healthcare providers know them, they know the qualifications and credentials of their health and fitness professionals, their registered dietitians, their health coaches, all of the allied health professionals who are receiving those patients. And so that they know them and they trust them and they know they will take good care of the patients that they send. And then I do spend a lot of time and effort around putting the resources, tools, technology in place that will support that referral from the provider to the allied health professional, and then that closed feedback loop so that they can work with the patient to report back to the healthcare provider. So the provider knows that the patient, it has followed through on that prescription or that referral. So if they followed through initially, if they followed through over time, also known as adherence, if they are engaged, if they are actually doing the physical activity or any of the other pillars of lifestyle medicine that we've talked about, and if they are progressing. And so that closed feedback loop, that two-way communication is absolutely critical to doing what we can't lose sight of what we want to do with these referrals, which is to improve health outcomes
Yeah.
and reduce healthcare costs.
Yeah. Yeah, I heard you say the word trust a few times in
Yeah.
that, and I'm wondering, do you think that's one of the major hangups that conventional medical providers have with referring patients to holistic providers, who are helping clients engage in fitness and nutrition? Is that there's this lack of trust between those
Yes,
two worlds?
I do. I think it's not just trust. I identify the barriers as being time, tools, training, technology, trust, and treasure or cost. Costs about concerns about patient costs, lack of reimbursement.
Mm.
So I think those are all critical. It's interesting when I look back at the publications that I have on over the last number of years, if I look at my presentations, a lot of times trust is in the title
Mm.
of those publications and presentations. So building trusted collaborative relationships between healthcare and health and fitness is a huge theme of my work.
Well, that sounds like very important and needed work. That sort of segues into this idea of the PHIT Act. Remind me what the acronym stands for again. Physical
Yeah. Yeah. So it's the Personal Health Investment Today Act.
Personal Health.
And we being over 130 health and fitness industry leaders were on Capitol Hill yesterday advocating on behalf of the PHIT Act. And I'll just give the elevator pitch for the PHIT Act
Yeah.
because I was able to do it so many times yesterday. What it does is it allows consumers to use their tax favored accounts like HSAs and FSAs for physical activity expenses. And the physical activity expenses that allows specifically are health and fitness center memberships, classes, fitness programs, and equipment.
Does
It,
fitness there's nothing to do with like healthy food or other lifestyle behavior change methods?
yes. So it's very narrowly defined. And I wouldn't put this in my regular elevator pitch, but I know for your audience, they'll appreciate the fact that what it simply does is it adds for qualified sport and fitness expenses to paragraph 1 of section 213D
Oh,
of the
Internal
Internal
Revenue
Revenue
Code.
Code of 1986. So that is what it does. It's very narrowly defined, and that is very intentional.
So is it including these 4 things as part of the definition of medical care?
That's exactly right.
Okay.
That's precisely right. And the reason that it is so narrow is one is to keep the score low. It, so bills are scored
Oh, okay.
about how much they would cost over a 10-year period. So, although you and I know that investment in preventive health has a significant return on investment in reduced healthcare costs, and depending on the literature that you look at, a dollar invested reaps between $4 and $7 worth of reward. That said, the way the Congressional Budget Office scores bills is it simply looks at cost or lost revenue. And so we did define it very narrowly. And it's actually defined even more narrowly in the sense that there's a $1,000 per person or $2,000 per family annual cap. And then there is also a per transaction cap of $250. So, for example, someone couldn't use that $1,000 annually for a purchase of one item.
Like an expensive exercise equipment, for example.
Exactly, precisely. And so those are the nuts and bolts of the PHIT Act. What I appreciated, and I have been advocating on behalf of the PHIT Act since, are you ready? May 25th, 2006.
Whoa.
That's when it was first introduced. And over the years, we have had a lot of bipartisan support, tremendous amounts of bipartisan support for the bill. I believe it was 2018, the bill actually passed through the House. But we have gotten some concerns. I've already talked about cost concerns. So the ability to demonstrate cost savings with that return on investment figure is really important. The ability to demonstrate how popular this is among consumers is really important. So the Health and Fitness Association did some polling earlier this year and found that 86% of voters support Personal Health Investment Today Act and their ability to use their HSA and FSA funds for sport and fitness equipment. And we learned that passing something like PHIT would inspire 17 million more Americans to engage in physical activity. So right now we know that 1 out of 4 adults meet physical activity guidelines. We also know that those who participate in structured physical activity at a health and fitness center are 50% more likely to meet physical activity guidelines. So, really important to demonstrate healthcare cost savings, the fact that this would change behavior in getting more people physically active, and that more and more people have access to these HSA and FSA funds. I think that increasingly people do have high deductible health plans and they do have HSAs and they do have FSA matching from employers. And so the fact that more and more people have access to them and would use them for physical activity expenses, I think really resonated when we were up on Capitol Hill. And I would love to get your perspective on, as you're hearing the PHIT Act and given the work that you do in the wellness law space, I'm curious your take on it.
Yeah, well, I have a follow-up question. So can you go over the very narrow 4 items that would be inserted into section 213D of the Internal Revenue Code?
Yes, I can. I can get the exact language
Very
here.
helpful.
Yeah, of course. So the limitations related to sport and fitness equipment. So if the equipment is used exclusively for participation in fitness, exercise, sport, or other physical activity, if it happens to be expenses for apparel or footwear, if it's necessary for physical activity, and I already talked about the $250 cap. So those are the limitations. And I think there are specific exclusions. So, and I think this is really important because so much of my work focuses on affordability and accessibility and really helping people who might not have access to physical activity or structured physical activity to be able to have access. So there's specific exclusions for golf, hunting, sailing, riding, private clubs. And so it is truly narrowly defined to be about sport and fitness equipment that is used for the purpose of sport and fitness.
And
So
it's
I hope that helps.
yeah, and it's not just equipment, it's also memberships to like a YMCA or some other
Precisely.
fitness facility. Now,
Yes.
another follow-up question is there a role or a requirement that a physician needs to recommend this for?
No, and I think that's really, really important. I spend a lot of time working with clients now on meeting current IRS guidelines,
Uh,
where if they have a condition or disease and a letter of medical necessity
yes.
from a healthcare provider, they can use said funds. And the what FIT truly does is it moves away from solely being about treatment
Yes.
of disease toward preventive health. So
Yes.
anyone can use the funds with the restrictions that you and I have talked about with the $1,000, $2,000, and then individual $250 cap can use these. And I should mention one thing that's near and dear to my heart. It allows usage of the funds for youth sports programming.
Oh, okay.
And we know how important it is to make youth
Yes.
sport programming, youth activity accessible because there's such a gap in
Yes.
accessibility.
And you have a book
So
about that, don't you?
I do. I
Yeah.
do. I do. I wrote a book. I spent about 2 years writing it, and I based it in part on my podcast. I had, at this point, I've interviewed about 130 experts in the physical activity and youth sports space, and I excerpted 20 of those experts and tied each expert to a theme in the book and then put tips. There are over 50 tips and 50 takeaways for parents, caregivers, coaches, teachers, fitness professionals, anyone who has a kid in their life and wants and needs a roadmap to get them moving more for better mental health, social emotional health, physical health, and academic development.
You don't need to sell me on the benefits of exercise. I think the book is a great resource, and I will make sure that it's linked in the description for the podcast recording. It's at Move to Live More. You have a link in that on your website, movetolivemore.com, to your book. But getting back to my thoughts on the FIT Act, it's a small step in the I think it's in a small step in the right direction. I'm all for, getting greater access to health or wellness types of activities. This is, as you say, very narrowly defined, but, is a step in the right direction to moving away from having only tax benefits for, getting people to a status quo level of health, as opposed to now, with if the FIT Act were to become law, people who want to optimize their well-being. They might be satisfied with their general overall level of health, but they want to get better. They want to do more, and now they can take advantage. They don't need to get, they don't need to have, as you say, a medical condition to benefit from some tax breaks on, physical fitness types of activities. So that's good. My only concern is that it could be a slippery slope, and I'm writing a lot about this, this distinction between healthcare and wellness. And from a legal standpoint, healthcare is so highly regulated,
Mhm.
and wellness is not. And there's some benefits to not being regulated. A lot of benefits, actually.
Mhm.
Some of the downsides are access. That is something that we have to contend with. But the access meaning, insurance doesn't cover it. It's hard to, get financial support for wellness activities. But on the flip side of that, the people who are offering these services, and the consumers who are able to engage in these services have more freedom in defining what it means, and, not having to have that heavy cloud of government oversight kind of over your head, which can really restrict, which is what I suspect happens a lot with people in conventional medicine. They feel kind of restricted in what they can and can't do because of all the regulation. And so I would hate to see that freedom and that flexibility that exists in wellness disappear with government oversight. I'm not I wrote an article about, the need for standards, no more Wild West, because the wellness from a from a legal standpoint is a Wild West kind of landscape. But and so I understand there needs to be some guardrails, some structure, which there isn't really any right now. But we need to find a balance. We can't repeat, I think, the mistakes that we've made in healthcare, which has become overly regulated to the point where it paralyzes people,
Mhm.
practitioners in particular, with fear, with just inability to do a whole lot because of all of the different stakeholders. And so, that's my only concern about going down this road. But I mean, I do think it would be a win. At the end of the day, the benefits would outweigh the risks. And
Yeah, I have a couple of thoughts. One is there was a lot of excitement in March of last year when the IRS clarified language around when physical activity expenses could be a qualified medical expense. And there was a misconception that they were truly treating physical activity expenses as preventive health. And really, the language around prevention is only prevention of progression of disease,
uh,
which is not
oh,
truly prevention of disease.
interesting. Where was that guidance that you mentioned?
That guidance was released by the IRS in their FAQs on their website.
Okay, I'll have to look that up.
Yeah. And the other thought that I had, yes, I have characterized some of this world as the Wild West as well. I think you and I agree on that. And so much of what I present on, advocate for is professionalization of the industry. And I think that is a win win
Mhm.
because it moves us further down the path toward reimbursement. And very interrelatedly, it builds that trust with the healthcare providers so that they know. And I've spent a lot of time interviewing healthcare providers about who they would trust or what they would trust. And it's referral not to a membership in a health club, it's referral to an evidence based program or a qualified health and fitness professional. So I do spend a lot of time working with clients, doing volunteer work with certifying organizations to raise the standards of the industry. So we're truly defining what a qualified health and fitness professional is.
Yeah.
So I think those are important points.
I wonder, just as maybe sort of a last point before we wrap up, because it was just announced, I think today, that President Trump has nominated Dr. Casey Means as the next U.S. Surgeon General. And I don't know a whole lot about her. I've just read a little bit, but she's, Stanford trained physician, not licensed. She became inactive in her license as a physician, but she did go to medical school at Stanford, and she is an advocate for holistic um, wellness types of services. I'm wondering if and when she becomes confirmed as Surgeon General, could you leverage her position and her support for this kind of work in passing the PHIT Act? I don't know. Just wondering your thoughts about that.
I think there were a lot of health and fitness industry leaders who are hopeful that there is an appetite for addressing whole person health. My personal opinion is that it's critical to have trusted messengers leading medicine and public health. And I don't see the lineup of messengers in Washington, D.C. right now being trusted messengers
Okay.
in medicine and public health.
Well, you certainly would have a better perspective on that than me, 'cause I haven't been paying that close attention. Just seeing headlines and thinking that, well, that's interesting. And yeah, so thank you for sharing that. And thank you for giving us an update on the PHIT Act, and fingers crossed that it does move forward.
No, soon. Well, no, soon. It
Hopefully.
needs to, if it's going to move, it's going to be a part of the reconciliation bill
Oh, okay.
that is being moved next week.
Oh, okay. So very soon. All right. Well, we'll have to keep close watch on that. And yeah, so if anyone wants to learn more about you and your work, would it be your website, movetolivemore.com, the best place to go?
Yes, people can find me at my website, movetolivemore.com. If they're interested in my podcast, it's /podcast. If they're interested in my book, it's /book. If they want to subscribe to my newsletter, it's /newsletter. And then I'm on all the social media platforms at Move to Live More.
Excellent. And you will be joining me in Kansas City in October of 2025 for the first ever Wellness Law Symposium. So I'm excited to meet you in person at that event. And if anyone listening is interested, just message me and to learn more about that. So thank you, Dr. Amy Bantham, for sharing your expertise with us today. I really, really appreciate it.
Thank you so much for hosting me. I'm delighted to be a part of your inaugural event.
Thank you for listening to the Wellness Law Podcast. You can find more wellness law resources by visiting the Center for Health and Wellness Law website at www.wellnesslaw.com, where you can also subscribe to our newsletter and follow us on social media. Until the next episode, stay well, stay hopeful, and stay legal.